I'm sorry for the trouble. Today, I would like to talk about rehabilitation in ALS patients, mainly about cybernetic treatment. This is from the ALS Guideline 2023. And the purpose of rehabilitation is to maintain and improve physical and mental functions and activities of daily living as much as possible, to encourage social participation, and to maintain and improve the quality of life of patients and their families. Many robots which are used in rehabilitation have developed over the years, and one of them is hybrid assisted limb HAL. HAL is a cyborg robot using the world's first technology that improves, supports, enhances, and regenerates the wearer's physical function according to the wearer's intentions. HAL weighs 14 kilos, and there are sizes from S to XL, and target weight is 40 to 100 kilos, and target height is 100 to 150 to 190 centimeters. Cyberdyne submitted a smaller model in this June for manufacturing and marketing approval, making children being able to use HAL as well. Here's the structure of HAL. First, there's the battery here, and with a single charge, HAL is able to move 60 to 90 minutes. And here's the control unit, which analyzes signals from each sensors and controls the movement of the power unit. And there are power units built in the hips and the knees, which assist the wearer's walking ability. And here are the force pressure sensors, sensing low level and assisting appropriately. So how does HAL work? First, the wearer tries to move, and then the brain sends a signal to the muscle to command movement, and a very faint signal that reflects the wearer's intention to move appears on the skin surface. With this information and information from built-in sensors activate together and support gait based on the wearer's intended motion. There are three control systems of HAL: and cybernetic voluntary control, cybernetic autonomous control, and cybernetic impedance control. Now let's talk about the effects of HAL therapy. In NCY 3001, it has been reported that HAL therapy significantly improves the distance in the 2-minute walk test by 10.066%. From this result, HAL has been approved in Japan as a medical treatment device for patients with neuromuscular diseases in 2016. These are the diseases which were approved. On October 28, 2022, HCLV1-related myelopathy and hereditary spastic paraplegia were also added. Although because these diseases are very rare and the patient numbers are scarce, the effects among each diseases are not fully investigated yet. So we decided to look into the effects of HAL among ALS patients in our facility. This is the result of one course of HAL therapy in 11 ALS patients. You can see that improvement was seen in the distance of the 2-minute walk test. As for long-term effects, we observed 3 patients who underwent 3 courses. The blue line is the distance of the 2-minute walk test, and as you can see, each patient showed improvement in the 2-minute walk test after each course, maintaining gait for approximately 12 months, which is a very long period considering the progression of ALS. This is an unpublished data of our facility showing that 2 SBMA patients showing improvement in the distance of the 2-minute walk test over 2 years of observation. Although we say rehabilitation in one word, there are many exercises included. First, there is aerobic exercise, which is a repeat of sequences of light to moderate intensity activities for extended periods of time. Resistance training, which uses a form of resistance. Standard rehabilitation, passive exercise, and daily activities. So what type is the most effective? Here is a study which Zhu has reported in 2022. They have reported that aerobic exercise and resistance training had the highest potential to improve physical function. And the combination of aerobic exercise, resistance training, and standard rehabilitation show the highest potential to improve QOL and reduce fatigue. Although there are limitations to this study that it only referred to short-term effects assessed immediately after rehabilitation. On the other hand, as I stated before, we were able to show that HAL has long-term effects. So there's no conclusion yet, and further investigation is needed. This is my last slide. And HAL therapy has short and long-term positive effects among ALS patients, and further study is needed to evaluate its effect. Thank you for your attention.